what I am going to do is going to move to the knee for the next touch. So I'm actually just going to come around to the same side that we're working on. Get my knee in position as close to the spine as I can. Again, no direct pressure on the spine. I'm just going to gradually start to add a little bit of pressure here. I'm also getting a little bit closer to the pelvis here with this touch. And I'm noticing that there's a little bit of a holding of the muscle. How about that there for pressure? Good. No pain? Do you feel it pulling on the joint?
No.
No? Okay, good. And if I add more, fine with that? Still no pain or pulling? No? Good. So I'm going to slowly release that, and then I'm going to do one more touch with the knee, but I'm moving closer to the pelvis. As I do that, I'm going to need to change my angle because the angle of the pelvis, I want to get in just superior to the iliac crest there. Getting into those fibers as close to the SI joint as I possibly can from this side. And how about that there? Un poquito?
Not pain yet.
Okay. Pero es como más sensible.
Ujú.
Okay, so it's a bit more sensitive there.
Llegando más cerca.
Okay. So we're going to maybe do a couple of touches here. One of the tricky things about an acute flare-up of pain like this is that you want to go gradually and start close by and get closer as you can and see what contributing factors you can soothe. So the idea here is, again, not so much to free up more movement of the SI joint, which is sort of the long-term goal, but in a situation with acute pain, we want to try and alleviate the current discomfort. And so we want to soothe the area around the SI joint. Oh, that was a good release. He just took a big exhale there and let the muscle relax a bit more. You okay?
Lo que pasa es que los músculos de la cadera,
Mm-hmm.
como hay dolor, ellos nunca sueltan.
Mm-hmm.
Nunca sueltan.
So you're going guarding
Y cada
around.
vez que yo trato de aflojar, hay dolor, entonces ellos
Mm-hmm.
están contraídos siempre porque quieren como mantener sin dolor.
Uh-huh. So he's saying that the with pain, he's constantly in contraction of those muscles, which is exactly what we want to try and soothe, because sometimes those extra contractions, that sort of the holding related to the discomfort of the pain, sometimes those long held contractions are actually causing additional pain with trigger points and things like that, not letting the muscle go through a regular cycle of contraction and relaxation can sometimes lead to that. And it can also sometimes be less pain than they would be experiencing otherwise if they let the muscle release. So it's a bit of a challenging mix here. We want to try and see if we can get some of those muscles to feel relaxed and soothed so that we can take a little bit of that pain away. Oh, a little bit of an adjustment there. Bien, ¿está bien? Intenso.
Ujú.
Okay.